for wheelchair users, the wheelchair is the means of getting out of the house. It's the means of essential mobility. It's the way they live their lives. It's essential to them being able to play a full part of society and do everything that they want to do. And so long delays are just not acceptable. My name is Christine McGee and I'm the Clinical Operations Manager for the Community Equipment and Disability Advice Services for Liverpool Community Health NHS Trust. It's really no use for us to be able to say, yes, you can have your wheelchair, but it's going to take 3 to 4 months before you can actually get your hands on it. Imagine if an able-bodied person were to walk into a shoe shop for a new pair of shoes and the shoe shop saying, well, yes, they're a lovely pair of shoes and they fit you really nice, but we'll send them out to you in about 3 months' time. And I think that's the analogy that you've got to use.
Prior to adult chair in a day, clients had to wait significant times following their referral into the service for their initial assessment. Once they came to initial assessment, they would then be prescribed with a chair. But as we didn't have that chair in stock, they would then have to wait significant time for us to order the chair, for it to go through our procurement system, for the chair to then come into stock and go through our pre-delivery inspection systems before we could then actually hand that chair over to the client.
And there were long delays in between each part of the process. So there were delays from referral to assessment, from assessment to equipment ordering, from equipment ordering to handover, and then from handover to chasing up any residual issues that the client found once they got the wheelchair home. And it was a very fragmented approach to providing wheelchairs at that time.
With the changes now in place, patients attend clinic or they can have home visits. They are provided the wheelchair on the day. It's fully adjusted for them. They will be provided verbal information about the wheelchair. They will have it a demonstration of how it folds, and it's more of a personal assessment and provision of the equipment. Again, they're not having multiple appointments, they're only having one appointment. They're seeing the one person.
The new adult chair in a day should enable us to achieve 70% of the clients that we see to be able to have their initial assessment and go away with the chair on the same day. This also means we can give a more personalised service and we can actually provide more of a shared decision making and a more informed decision about the type of chair that they are assessed for and that they go away with. Because it means that they can actually try the chair, they can try the exact size, the exact type of chair that we feel meets their clinical needs and that they feel meets their social needs and the carers' needs. It also means that for the 30% that unfortunately are more complex and we perhaps can't meet their needs that same day, that we as therapists will have more time to spend on those clients and with those clients, ensuring that their prescription is the best that it can be and meets their needs.
There's a perception that getting a wheelchair in Liverpool is difficult and that it involves a delay, and I think that's a general perception across everybody that's out there in the community based on historical data that the wheelchair service really didn't have a very good reputation, neither with our NHS colleagues who were referring into the service, nor with the service users that have used the service. And I think getting rid of that history can be quite difficult. It can be quite difficult to change people's perceptions. And so the wheelchair service has got a lot of work to do in changing the perceptions of how it delivers its service, and we're putting quite a lot of effort and energy into sort of like trying to involve people in what we do. We set up a wheelchair user group in Liverpool, but we wanted a wheelchair user group that was proactive, that would help us redesign the wheelchair service and have that service user's voice at the core of everything that we did. I think it's very, very important as a manager of services that service users help to shape and direct services that are provided on their behalf, and getting that service user voice right from the start in how you design services, for me, was an essential aspect, because you can't just tinker around the edges. What we did was we acknowledged right from the beginning that this was going to involve whole-scale change across every part of the service, and so we needed to create the vision, attract people to that vision, and then bring people into that project team that that were signed up to that vision and helped us to drive that change forward.
I think the wheelchair service in a day is an excellent idea, and it stops people getting waiting all the time. I'd simply by being excellent. I didn't have to wait that long, and I got the exact wheelchair that I wanted, and it's easy to fold away and put it in the boot of the car. So it's happy days for me.